Hello, welcome back to the channel. My name is Bridget. I'm a nurse practitioner and nurse educator, and today we are going to be covering ACE inhibitors. If you would like a copy of this PowerPoint, you can join Patreon. I will include the link in the description below to this video. And if you become a member, alternatively, if you just want to purchase this PowerPoint as a one-time, then it is $5.97. It is for sale here. It's $5.97, but it is available to all paid members if you are a member. ACE inhibitors are very commonly or frequently tested, so it is important to make sure that you are familiar with ACE inhibitors. ACE inhibitors, or angiotensin converting enzyme inhibitors, are medications that help lower blood pressure by preventing the conversion of angiotensin 1 to angiotensin 2. Angiotensin 2 is a potent vasoconstrictor. So if something is constricting the diameter of something, it's making it smaller, the pressure is going to rise. Even though it doesn't really translate perfectly, but think of the analogy of what's easier to put on, some loose pants or some really tight pants, right? The tighter the pants, the harder it is to get them through your legs and your thighs, right? You have to do the weird whole kicking motion. So same principle. When if water or fluid, whatever's in the vessels, if you think of like a pressure washer, right? That is a high pressure system. But if you have a larger hose where the water can go through, then there's going to be less pressure. So when angiotensin 2 is blocked, then this allows blood vessels to relax and blood pressure drops, and it prevents blood pressure from rising. Common use of ACE inhibitors, when you're tested NCLEX World, it's mostly going to be for high blood pressure, especially when you're first starting out. So you really need to know that it's for high blood pressure, hypertension. Other uses include heart failure. It improves cardiac output and symptoms. Post myocardial infarction, so after a heart attack, and for diabetic nephropathy, it's renal protective, so it helps patients with diabetes and chronic kidney disease. Common ACE inhibitors that you need to know. Remember your PRILs. I always tell my students that it's easier to remember, let's say, for example, 20 drug classes versus having to try to memorize 1,000 medication names. Your brain learns by chunking and by categorizing. So if you can start with memorizing classifications of medications and memorizing commonalities within those drug classes. So, for example, ACE inhibitors, beta blockers, calcium channel blockers. Start with each of those, right? And then narrow it down to what's unique to that drug class. And then you can start memorizing endings. So, beta blockers end in the LOL or LOL, ACEs end in PRILs, and learn side effects that are unique to that drug class. So with ACEs, think of PRILs. That's how they end. So lisinopril, captopril, enalapril, ramipril. Lisinopril will be the one most frequently tested. So keep that in mind. Now, what are some side effects that you need to know? So I made this little mnemonic for cough and angioedema. And even though angioedema is one word, it helps the students remember angioedema. But cough is a dry, persistent cough. It occurs due to the bradykinin buildup. If this is on a test, if you see it on a test, what would your nursing intervention be? You would notify the provider, because that cough is not normal for them to just live with a chronic dry cough. It is very irritating. It is very annoying. So again, the intervention on an NCLEX test would be to notify the provider. You also want to monitor for hyperkalemia. That's elevated potassium levels. So watch potassium levels closely. Again, if they have this medication is renal protective up to a degree, right? But if they have renal failure and then their potassium's building up, then we have to weigh the pros and cons. So watch potassium levels closely, because in renal failure, potassium excretion is not adequate. Angioedema is swelling of the face, lips, and throat. This is a life-threatening emergency. You do want to monitor for that. We'll talk a little bit about cultural considerations here in a little bit about angioedema. But if you look up angioedema, it looks like they were stung by a bee. The swelling is pretty significant. And again, we're worried about airway obstruction. If, for example, the tongue swells up so much that it obstructs the airway. Nurses should monitor blood pressure. You want to check blood pressure medication, obviously, before you give something. If they're hypotensive, you're not going to give a blood pressure medication. You want to check renal function, monitor BUN and creatinine, potassium levels. You're watching for hyperkalemia. Patient education. Educate patients to avoid potassium rich foods and salt substitutes. So, fun fact, people that are on have high blood pressure, they sometimes will use a salt substitute instead of using salt, but those salt substitutes have a lot of potassium in them. So if they don't know this, this is going to further elevate their potassium levels. Warning signs: you want to teach patients to report swelling, rash, or trouble breathing immediately. Contraindications and cautions: who cannot take ACE inhibitors? If someone is pregnant, especially in the second and third trimester, they're teratogenic, so they harm the fetus. Bilateral renal artery stenosis, it can worsen kidney function. History of angioedema, if they've had it before, they can potentially get it again. So, the risk is that it reoccurs and is potentially a life-threatening reaction. NCLEX tip: if a patient develops a cough while on lisinopril, the provider may switch them to an ARB like losartan, and ARBs will end in tan. Um, ACEs cause cough, ARBs usually don't. ACE inhibitors end in pril, common side effect cough. You want to monitor potassium levels. With ARBs, no cough as a side effect, but you're still monitoring potassium. Key takeaways: don't forget that ACE inhibitors, you want to watch for cough, hyperkalemia, and angioedema. Um, Three major side effects that are usually tested on: it's the cough, hyperkalemia, angioedema. Of course, there's a slew of other side effects, but these are the most commonly tested. Remember, the pril ending is an easy way to identify ACE inhibitors. For common uses: high blood pressure, which is hypertension, heart failure, post MI, diabetic nephropathy. Like I said before, there are some cultural and population considerations regarding ACE inhibitors. So, ACE inhibitors, angioedema is more likely to occur in Black patients, and also ACE inhibitors are less likely to be effective in Black patients. So, then it makes sense that, hey, we're not going to start them on ACEs because of the risk of side effects and less efficacy. So, when prescribing or administering ACE inhibitors, it's important to understand that Black patients may have a reduced blood pressure response to ACE inhibitors when used alone, especially compared to other populations. Because of this, clinical guidelines often recommend starting with thiazide diuretics or calcium channel blockers in these patients unless there are compelling indicators like heart failure or diabetic kidney disease. Also, studies show that Black patients have a higher risk of developing angioedema from ACE inhibitors. This is a serious adverse effect involving rapid swelling of the lips, tongue, or airway, and it can be life-threatening. Remember this for the NCLEX and clinical practice. Medication response differences: know which populations respond better to which antihypertensives. Recognize higher angioedema risk in Black patients. Always monitor closely and educate patients about these risks. Alternative first line agents might be thiazide diuretics and calcium channel blockers. And when ACE inhibitors might be indicated is heart failure or diabetic kidney disease. Thank you so much for watching. Again, if this helped, give it a like, subscribe, and check out the full pharmacology playlist. And what medication should I cover next? Comment below.